It's the most important thing you're going to see on TV today. Pancreatic cancer often has no early warning signs, and right now there is no good screening test for the darn disease. Dr. Sharif Boutros from the Tate Cancer Center at the University of Maryland, Baltimore, Washington Medical Center joins us right now. Thank you for doing the great work that you're doing, the pancreatic cancer. We're going to talk about this clinical trial. Do we know what causes this darn disease?
Well, there are some hypotheses. We know that it is related to inflammation of the pancreas. We know that can be related to a disease that runs in family. We know that there are some predisposing factors for that. But we really don't have a clue about the real screening way to know about it at early phase.
I'm telling you, people would go into a doctor's office tonight, if they could find out down the line if they are going to get it and if there's anything they can do to stop it. But what you want to do with this clinical trial is have people with stage 3 come see you, right?
Correct. I mean, unfortunately, this is the vast majority of patients who get diagnosed with pancreatic cancer. We see them, in fact, in 3 categories. The early disease that we can offer them at the Tate Center, a minimally invasive surgical resection, basically removing of the tumor with laparoscopy or robotic technique. Unfortunately, the vast majority belong to this group that's called locally advanced, where the tumor did grow enough that it is so much surrounded by important structure that we cannot just remove it. In this case, typically patients receive chemotherapy, radiation therapy, with the hope that to shrink the tumor to be able to resect it.
How excited are you about this?
Well, unfortunately, not all of them get shrunk enough to be able to be resected, and there is nothing to offer for them beside that, chemotherapy and radiation. Besides now the clinical trial that I'll be happy to talk about it today.
Yeah, and what do we go through in this clinical trial? We walk in your office and then what happens?
Basically, it is a surgical resection that's combined to an ablation. We'll try to ablate the area of the tumor using a new technology called irreversible electroporation or nanoknife. Using electricity as a source of energy, we create permanent holes on the cell membrane of the cancer cell without injuring any of the surrounding structure, and the cell cancer die with time.
Do you give them more time because of this? Are you giving us more time?
Well, it is a clinical trial, so basically we don't know the answer yet. But the hypothesis is obviously if we combine that with surgical resection, we are hoping that we offer the patient a complete cure for the cancer, yet we have to prove it.
How excited are you about this clinical trial?
I'm very excited, very excited.
You've been this excited before or no? I mean, this is like cutting edge, right?
It is.
Oh my goodness, give us hope, will you, doctor, about this?
I think there is a real hope here, but we have to wait for the final result of this clinical trial.
Okay, and it starts when? And how long will you go with the clinical trial?
It is in fact ongoing. We treated already patients with this technology.
Are you seeing any kind of... yeah, the thing about it is when you find out it's too late that you have it. Is there any... you said you found out early diagnosis. How early are we talking about when you found it?
Well, most of the patients that got diagnosed for early stage pancreatic cancer, the diagnosis was made with a CAT scan that was done for a completely different reason.
Real quick, this is so... what are the symptoms? Are there symptoms, or is there like the belly ache or whatever?
Most of the patients, in fact, have no symptoms when they get diagnosed with pancreatic cancer unless they develop jaundice, turn yellow, or in fact a rapid weight loss or a new onset diabetes with no other predisposing factors.
Doctor, keep the great work up, all right?
Thank you very much.
Oh, I'm so excited about this. Now listen, if you or somebody you know wants to take part in this clinical trial, here is the information. You can contact Dr. Boutros at the Tate Cancer Center. Here's the website and the phone number. And if you don't get a chance to write it all down right now, no worries. We're going to post it on our website at abc2news.com.